entitled PIK3CA Status in Circulating Tumor DNA Predicts Efficacy of Buparlisib plus fulvestrant in postmenopausal women with endocrine-resistant, hormone receptor positive, HER2 negative advanced breast cancer. First results of the randomized phase III BELLE-2 trial. Mario.
Thank you very much. It's my great pleasure to present you the first results of BELLE-2 clinical trial. My conflict of interest are in the slide. BELLE-2 is a randomized double-blind phase III clinical trial of buparlisib in combination with fulvestrant in postmenopausal women, hormone receptor positive, HER2 negative, advanced breast cancer, progress on or after with anti-aromatase inhibitor. Randomization was stratified into activation of the PI3 kinase pathway and presence of visceral disease. The primary endpoint was PFS in the full population and the PI3 kinase activated group. PFS in mutant PI3 subpopulation patients detected by liquid biopsy was an exploratory endpoint. The key inclusion criteria were postmenopausal women with ER and or PR positive breast cancer, HER2, inoperable locally advanced or metastatic breast cancer, disease progression on after anti-aromatase therapy defined by recurrence during or less of 12 months from end of adjuvant anti-aromatase therapy, progression during or less than 1 month from the end of anti-aromatase therapy for locally advanced metastatic breast cancer, measurable disease or not measurable disease, lytic or mixed bone lesion, adequate tumor tissue for analysis of PI3 kinase-related biomarkers. The key inclusion criteria: prior therapy with PI3, AKT or HAM2 inhibitor or fulvestrant, not more than one prior chemotherapy line for metastatic disease, history of or active anxiety, depression, or major psychiatric disorder. The most common all-grade adverse event, grade 4 and 3 and 4, from the combination of BKM and fulvestrant were increases liver enzyme, hyperglycemia, rash, and mood disorder. The study met its primary endpoint. For the full study population, median progression-free survival of the combination arm was 6.9 months versus 5 months for those in the placebo arm, with a reduction rate of 22% risk of progression. For the study population of PI3 kinase activity, the median PFS was 6.8 versus 4.0 in the placebo arm, but is not statistically significant. We evaluated in prospective subpopulation of patients with a PI3 kinase mutation detected by liquid biopsy. Liquid biopsy were blood sample drawn from cancer patients to analyze trace among the free-floating tumor DNA in the blood. The minimally invasive test offers several advantages over conventional tumor biopsy. Since surgery is not needed, patients can be tested more frequently. And in BELLE-2, blood sample from 587 patients were analyzed for this PI3 kinase mutation in the liquid biopsy. The association of BKM and fulvestrant improves the median of progression for survival in subpopulation of patients with a PI3 kinase mutation detected by liquid biopsy, 7 months versus 3.2 months, compared to the placebo arm, with a 44% reduction in risk for progression. There is no difference in terms of progression-free survival in not-mutant PI3 kinase subpopulation patients detected by liquid biopsy between the two arms. In conclusion, the BELLE-2 met its primary endpoint, demonstrating prolonged PFS for combined buparlisib and fulvestrant in postmenopausal women with ER-positive, HER2 negative, and breast cancer that are progressed after prior anti-aromatase therapy. It is the first time we show that inhibiting the PI3 kinase pathway may be a viable option for patients with hormone therapy-resistant breast cancer. Frequent discontinuation due to adverse event reduced treatment duration in the buparlisib arm, potentially limiting the efficacy of combination therapy. Patients with tumor harboring PI3 kinase mutation detected by liquid biopsy perform poorly on fulvestrant monotherapy achieving a clinically meaningful PFS improved with buparlisib in a fulvestrant, 3.8 months, with a higher response rate than 20% comparing to the 4% in the patient population. BELLE-2 study suggests the assessment of PI3K mutation in liquid biopsy may help select patients who will benefit from adding a PI3K inhibitor to endocrine therapy. Future studies were warranted to confirm the utility and the predictive value of PI3K mutation detected by liquid biopsy and the tumor biopsy, what to see in the SOLAR study, a clinical trial. Thank you for your attention.
Thank you. Mario, the audience may not know, but there are different hotspots of mutations in PIK3CA. Some of them are in the helical domain, some of them they're catalytic domain, and they seem to have various strengths, if you will, in activating PI3 kinase. Were there enough patients here to begin to subclassify patients into where the mutation was and outcome?
Yeah, in tissue, you have the Sanger method to detect some mutation in the principal exon. But with the technique was the liquid biopsy is the host spot, is a classical host spot of PI3K mutation.